I'm Dr. Irish Spencer, and I have just toured one of Greensboro's best kept secrets. Doesn't need to be a secret, shouldn't be a secret. It's called the mustard seed.
My name is Beth Mulberry, and I am the medical director and the medical provider at Mustard Seed Community Health. Mustard Seed offers pretty much everything you would expect in a primary care medical setting, plus we also integrate our primary medical care with behavioral and mental health care. So if you have an illness or a small injury, if you need a complete physical, a well child checks with the immunizations, we do all of those things. Chronic health care, diabetes, hypertension, all of that stuff. We also take care of depression, anxiety, all those sorts of things.
For so many communities like the community in Cottage Grove,
mental health isn't something that's culturally acceptable. Introducing the idea that it's not about your deepest, darkest secrets all the time. It's about getting through what we're getting through right now and managing as best as possible, as healthy as possible. And that's what I'm hoping I can bring to the community. With the integrated care that we do here is serve each community member holistically. So they have both mind and body taken care of.
The whole idea behind Mustard Seed was to focus on health of the community and not just health care.
New Hope Community Development Group, which is a nonprofit that I am the president of and co-founder, we were already concerned and trying to work up a program where we could get a physician in this community. The last time a doctor's office was in this community was around 45 years ago.
So New Hope Missionary Baptist Church, this is the pastor's home. We took it over as our clinic. We felt that primary care associated with the behavioral mental health care needs to be in the community that it serves. So if nothing else, they could walk to their appointments. And then we were also going to work with other agencies so that we could help them access healthy food, that we would work with agencies to help support education of the children in the community and the adults, and work with agencies to get jobs.
We're a small organization. Right now we have 5 staff, and then we have 3 community health workers, which are our representatives, community representatives that work with us and reach out to the community. And so with such a small staff, we not only know each other well, we know our community members well. They see the same person every time. They know the same people are here. They know they're going to receive the same kind of care. And then on top of that, we have the 2 social work interns. And that just allows the community members to recognize faces when they see them. And when they reach out, they know the voices that are speaking to them. Oftentimes they hear me and they know exactly who's speaking to them before I have to say anything. And so I think that personal care where you get to know the community that you're working with is one of our biggest strengths.
What's it like being here in the community doing what you do?
So not only do I work here, I also live in the community. I live on English Street, right down the street.
Okay.
So to be able to be here and to help in a lower income community, I thrive on that.
That's awesome.
I thrive on that. Of what's going on. 2020 has been a doozy in a lot of ways. But to know that my patients trust me and that I have instilled that confidence in them, that they can come to me, it makes me feel great. And that's why I get up every day and do what I do. Without now that Corona has hit and COVID-19, people that had jobs and did have insurance now don't have insurance and they don't have their jobs anymore and they're struggling. Being able to be here and to provide that type of care giving, be it blood draws, whatever it needs to be, if they need their labs, their medications refilled, providing those resources, having avenues to get diabetic patients their glucometers because they can't afford to do it right now. I think that's a major thing, and we could really use the help with that right now.
Mustard Seed Community Clinic in Greensboro joins 67 other free and charitable clinics across the state of North Carolina, whose purpose is to provide important healthcare services to those who don't have health insurance. It's a noble task, and the Mustard Seed Clinic stands out as one of our finest members. I've enjoyed visiting the clinic and seeing Dr. Beth and her team there. They're doing such great work in the Cottage Grove community.
You know, we have all these different communities, folks that were born and raised here in the United States with different backgrounds, and then we also have a lot of immigrants and refugee communities too. If we have somebody from each of those communities working as community health workers, you build the trust from the community with those folks representing them and going back and forth with all the folks that are trying to lift the community up to have better health.
So one of the things that I really like about Mustard Seed is the diversity. You know, the different staff members that speak different languages, and then me coming as an intern, I also contribute another language into the clinic. So if there might be a patient from our community or something, that might be another useful resources to the clinic. So that's one of the things that I really like about Mustard Seed.
And it's awesome that you're in this community and that you're seeing everyone, regardless of the language barrier, they can still come
Yeah,
to
we
the
find a
Mustard
way
Seed.
to assist them, whether it's, over the phone, interpret over the phone, or, they will say, I'll bring my cousin, I'll bring my, sister. But we find a way to provide the health care that they need.
This is more than a medical practice. This is a community center where people can come and get other resources. And so that was my initial involvement with Mustard Seed.
Well, tell me, do you see where it is really needed and has been a blessing to this community? Do you see that?
I do see that. It is a blessing to this community. I don't know how much history you know about this community, but it's been over 40 years or so, and probably longer than that now, when Dr. Jones had an office, and the building is right down the street still. And so there was no medical practice in this community. And so yes, it is truly a blessing. I encourage folks in this community, you can walk to the Mustard Seed Community Health Center and get medical treatment.
You're a community health worker. What exactly does that mean?
A community health worker is like, we go into the community, and a lot of times we have referrals that we need to check on. And we have a lot of senior members that live in there. And all of them are not patients with the Mustard Seed Clinic. They just live in the community. And we go in and check with them and see if they're sick, if they need anything, their food sources, they are able to do for themselves. And during the pandemic, we have been real busy. We've been giving out food.
Wow.
And we're giving out masks to neighbors, and we have a lot of the elderly members in the community. They're not able to get to a grocery store, and a lot of them don't have family, or if they do family lives out of town, on the other side of the town. So I on Mondays go and pick up food, and my other coworker, Joanne Foster, we meet here and divide the food up, and we pass it out to the families, and especially the families with children. We pick up the school lunch meals and give it to them. So we just try to make sure that everybody is safe and healthy.
Does it help to live or be a part of the community to know where the need is?
Yes, it does. It does.
Not only caring for somebody's health, but you're also caring for their well-being,
Yes.
the holistic approach, everything.
Yes,
That's
yes.
awesome.
Being a community health worker, we are caring people. We trying to help people. We trying to make the neighborhood healthy. But we got a garden right here at the Mustard Seed too. It help people to eat right and all that. Help people with high blood pressure, help people with diabetes, and, you know, just helping people medical, you know, too, you know, that have all kind of issues going on. So this place is very amazing.
It costs so far less to be able to provide primary health care for someone that has hypertension. $4 a month for a blood pressure medicine, and maybe a couple doctor's visits during the year. Let's say $250 each for the doctor's visit. $548. Compare that to tens to possibly hundreds of thousands of dollars when they're 45 and they have a catastrophic stroke and they end up in the intensive care unit. And now not only do they have this incredible hospital bill that all of us are going to have to pay for because they're uninsured, but now they're also disabled and they're not going to be able to work at all and support their family. And so that's got a cost with it as well. That's the economic part. And then there's the moral part and the morality of allowing that to happen. If we saw all these people suddenly dying on the street, there would be an uproar about it. But it happens quietly and one at a time. And I would encourage people to think about that and really think about what the costs are and make a better decision about making sure that all of us have access to really good health care. And that includes both mental and behavioral health with that as well. Healthy housing has been so important, and we've actually had some pretty significant interventions over here in East Greensboro with regards to that. So if I have a patient, let's say, that has asthma or allergies, I'm going to ask them about the condition of where they live. Do they have water, moisture issues? Do they have roaches? Do they have mold and mildew, all which tend to relate to each other? And we've had some pretty significant concerns. We had an apartment complex over to the east of us, just across the road basically, and there were so many people living over there that were having health issues because of poor housing. And some of them were sewer issues as well. So we do a referral to Greensboro Housing Coalition, and they do a healthy homes inspection with the renter has to agree to it. And this can be for people who own their homes too. And they just do an evaluation with them there and tell them, okay, here are the problems, here are the things that probably would help with this. And if they've tried with their landlord to have something fixed that would take care of the situation, and the landlord is not doing those things that need to be done, then Greensboro Housing Coalition can advocate for them in those ways.
Immediate community clinics like Mustard Seed are essential, and they can sort of hit the ground running.
Of course, any nonprofit needs funding. It takes money to operate. Mm-hmm. And so I would ask people to dig even deeper. You know, we're not having to do as much riding and buying lunches and going into work. Channel some of that funds into Mustard Seed, because what you're doing is uplifting community. You're uplifting Mustard Seed, you're uplifting the people in the community.
We try to find funding. Most of our care is done through funding, and so that we can even that care out and allow for us to get them like immunizations and labs that they need, etc. It's still a problem, and I would say at this point that's why we need better coverage for everybody in this country.
There is a place in our community that truly is a community health center, and it's the Mustard Seed. Thank you for being a part of this community of Cottage Grove.